Hello, my name is Dr. J. Michael Bennett. I'm an orthopedic surgeon specializing in sports medicine. Today we're going to go over the A to Z in the shoulder. I'm going to try to really explain as much as I can in regards to shoulder pathology in this short segment, just to give you kind of an overview of what you can see from the rotator cuff all the way to replacement. So first off, let's go ahead and start with the shoulder joint. In regards to the anatomy, you've got the ball in the socket of the shoulder joint that's surrounded by the muscles of the rotator cuff. You have a front muscle, the subscapularis, you have the supraspinatus up top, then you have the infraspinatus and teres minor in the back. These all hold that ball and socket mechanism in place and give you strength and power when you're pushing up and when you're lifting out to the side. The problem is over time, these tendons here, they tend to get a little weak. They tend to get a little frayed. They get a little tendinitis, tendinosis. Sometimes you can even get some calcium deposition in the tendon, which leads to a rotator cuff tear. Most patients will usually find that they have a lot of weakness with overhead activities. You usually feel pain at night when you're sleeping, particularly pain out to the side or above your head. Sometimes you can have a little bone spur under here too, which also can contribute to this. But the big issue that we worry about is when you have a tear, this tendon here, particularly supraspinatus, can tear off of the bone and sometimes actually retract, okay? So rotator cuff tears are essentially, timing is of essence in regards to fixing these. The longer you wait on a rotator cuff repair, the more this tendon retracts and the less coverage you have over that ball and socket. So you no longer have a roof over your house. That ball is now exposed. The problem is when you lose that tendon coverage, the rest of this muscle contracts and it becomes very, very hard sometimes to pull it all the way back and repair it back down to where it's supposed to be because that muscle loses its elasticity. So typically we repair this with a couple of anchors. You do it all arthroscopically with some poke holes in the shoulder, go in there with a camera, find the tendon, pull it down, and actually repair it down to the bone with a number of anchors. You can have tears of any of these rotator cuffs. Supraspinatus is the most common. You can have a subscap tear in the front, and then you can have tears in the back with the infraspinatus and teres minor. Or you could have tears of all of them and have what's called a massive rotator cuff tear involving all rotator cuff tendons, and then you have no coverage over that ball and socket mechanism. So when we repair a rotator cuff, we usually do this arthroscopically with some anchors. So the anchors are actually put into the bone and they look like we use little absorbable anchors or suture-made anchors that actually get tapped into the bone, and they have stitches that run through them, and the stitches actually run through the tendon and loop up against these anchors, and it pulls the tendon down and reapproximates the tendon down to bone where you can get good healing, okay? And so basically we're putting the anatomy back to where it's supposed to be. And that's primarily the basics behind a rotator cuff repair.